Hi everybody, and thanks for joining me on this live stream. It's good to be back. It's good to be sharing a few more tips on how you can help your brain to help you heal your pain. Well, I had a patient I saw this afternoon, and I was talking about pain, and he mentioned how he gets irritated when a doctor says to him, "Look, the pain is in your head." And, for obvious reasons, it's a horrible thing to say to somebody. I think that the real reason for that is the idea it's just made up, it's imaginary. There's nothing pathological or organic about this problem. It's not something you can see. It's just something you make up, which is not true. Chronic pain is a neurological condition. It is in the head, it is in the spinal cord, it's in the peripheral nerves, it's in the endings of the peripheral nerves, these sensory nerve endings that we feel all over our bodies. So it's not in your head, it's all over your nervous system, and even more than that, it's affecting your emotions, it affects your thoughts. So when you consider the mind as well as the physical body, it affects the entirety of us. So we need some help. We need tips on proven ways to help this problem. So as a continuation from last week, tonight I'm sharing 3 more tips that I use on a daily basis with all my patients. In fact, on the first visit, these are the things I talk about. So the big one is no talking about chronic pain. Now, this is tricky, especially if you come from maybe a family or a culture that likes to talk and likes to express what's going on in life. And if that's pain, then that will be included. But it was the work of David Hanscom, a great surgeon from Seattle. He's now moved down to Oakland near Los Angeles. And in his book, Back in Control, and on his website, backincontrol.com, he talks about how for the last 6 or 7 or 8 years that when doing workshops in New York, that he found that a major breakthrough was when people at the workshop with chronic pain for many years had remarkable results. And one of the key things was not talking about pain. It was something that he didn't really understand to begin with, then became very apparent. So he's been utilizing this technique in his practice for many years now. And I find with my own patients, it's quite alarming to think how often we actually talk about pain. Now, the reason we're not supposed to do that optimally is because every time you speak about it, you re-trigger the program in your brain for pain. And you don't want pain, you don't talk about it. So one little tip here, if you've got family members who are always asking you, or colleagues, just say, hey, it's not helping me by talking about it, so we'll talk about other things. And by the way, they're going to know that you're in pain anyway by the expressions on your face and by the body language you have. So you get lots to talk about, but not about the PAIN word. So that's the first thing, don't talk about it. The second tip tonight is negative thinking. Now, with every patient I have, I do an assessment called the pain catastrophizing score. And it's a list of 13 questions, and it's all about how often do you think negatively about pain, and categorizes these scores into 4, and therefore a maximum score is 52. So, on average for a patient attending a pain clinic, it's about 26. So there's lots of negative thoughts. If it's really high at the 40s and even 50, 52, then there's a lot of work to be done on this level. So what do we do with our negative thoughts? Well, first step I would say is write them down. See what they are. Start changing them. Get rid of the negative and replace with neutral statements. Your pain is in your back. Okay, that's a neutral statement. Not, my pain is in my back, it's horrible, it'll never go away, and I'm really worried. That doesn't help you. Just write what it is, or say what it is. If you really must speak about it. But writing about your pain when it's really a struggle and you're having an awful day is really therapeutic, and I strongly recommend my patients to do that. Okay, so no negativity, neutrality, or if you can, be positivity, although that's a bit of a stretch for a lot of people. But be neutral with your thinking. And the third thing tonight I'm going to share is affirmations. It was great to have a French patient, a new patient this week, that I was talking about Emile Coué. And he was a Frenchman from Nancy in France. About 100 years ago, he developed the autosuggestion technique called autosuggestion, which just really means positive statements said to yourself, suggesting to yourself. And his one that he coined up was, every day and every way, I am getting better and better. Every day and every way, I am getting better and better. And he recommended his clients back then to say it 20 times in the morning and also 20 times at night. And it's a great little affirmation that it covers all problems, and it also covers a wide range of beliefs around your problems. You know, if you can't say I'm going to get better and better every day, you could say I'm going to get a little bit better. And if that's honest with you, go with that. But anyway, the reason for saying affirmations is because we need to program this brain into a new reality. And that is what happens when we take charge of what we think and what we say. You know, these are two forms of creation, and it's really important that we rein in the wild horse that is going on in our lives with our pain, and rein it in and to be in conscious awareness and control of the words you say. And if you say these positive affirmations over time, what is actually happening is you're giving yourself a chance to go down the direction of healing your pain. It's a bit like jumping in a car to get to a destination B, and say you're at destination A to begin with. Well, the only way you're going to get there is if you travel down the road in your car to get to destination B. Well, that's like chronic pain. We've got to aim in the right direction. We've got to get the map out. We've got to know where we're going. And with your speech and your thoughts are fundamental things that direct the direction of your, or the path of your journey towards that healing pain. So if you don't like that affirmation, you can pick your own one. It doesn't really matter which one you pick as long as you get on the bandwagon of repeating this statement. And I would also encourage not just to do it morning and night, but do it through the day as well. Do it as much as you can, because the more you focus, the more you look forward in this direction of healing pain, the better chance you will get there. So these are 3 tips that I use regularly. I hope you find them helpful. Try them out. And you maybe have heard of these things before. That's great. The question is, are you doing it today? Will you do it tomorrow? You know, every day is a new day, and we need to start afresh and do the things that are going to help us the most. So these are my recommendations for my patients, and I encourage you, if you haven't tried them, try them and embrace them and allow them to become a part of your journey. Okay, thanks so much. Good to see you, and you take care. Bye for now. Thanks for joining the course. I look forward to seeing you next time.